Good morning. This is Rebecca McCall. I'm doing my final paper on the left ventricular assist device. I had a really hard time trying to decide what to do my innovation paper on. I don't really have a specialty right now. I'm a supplemental nurse, so I float from floor to floor, so I was kind of struggling to decide on a topic. But my background is in congestive heart failure, and I find the lvad really interesting, and I don't know a lot about it, so I thought it would be a good topic to start to research. So 5 East is the floor at LGH that primarily takes care of the lvad patients after they come out of the ICU. I do work on 5 East sometimes, but I don't take care of those patients because they're so specialized, and I'm not trained to do that. So so I'm anxious to learn a little bit more about it. LGH does have an lvad team, which consists of the cardiac surgeons and some nurses and nurse practitioners that specialize in that field. So the left ventricular assist device is a treatment for congestive heart failure. It's kind of like, as the symptoms and their clinical status worsens, patients kind of run out of options eventually, then leads to death. Heart failure is a huge problem in the U.S., as some other people have mentioned. There are about 5 million Americans currently that are affected by congestive heart failure. So, as their condition worsens, more aggressive therapy is needed. The left ventricular assist device is a surgically implanted pump that is, it supports heart function and blood flow. There are 3 different types of VADs, ventricular assist device: the right ventricular assist device, a biventricular assist device, and the left ventricular assist device. The left is the most common and the most user-friendly. Patients can go home with a left ventricular assist device and are able to kind of manage it on their own. The lvad, you need to be hospitalized for that pretty much the entire time. So there are kind of 2 purposes of the lvad. The first is called destination therapy, and that would be, there's really no possibility of a transplant. The patient's not a candidate. So the lvad is placed just to kind of help the patient, to give them more time and quality of life with no plans for transplant. The other is bridge to transplant, which is obviously the patient is a candidate for a heart transplant, and they're just kind of waiting for that time to happen, for a heart to become available. So just look at my notes here. I have a kind of a picture, it's in black and white, of a lvad, but I thought it was kind of cool. I wanted to share it. So it's an external pump connected to cannulas that offload the left ventricle. So there's an inflow and outflow cannula, a pump, a drive line, a system controller, and a power source. It's usually like a battery pack that's outside of the body, obviously, that it's all connected, and it works by unloading the left ventricle and pumping blood to the aorta. And it's able to extend and improve quality of life because of that. So there are some complications that arise, obviously, from a device such as this. There are like 4 or 5 major complications I'm just going to review quickly. The first is infection. Obviously, with any line or device, as we all know, there is a high risk for infection. So it's critical to use sterile technique and take really good care of the insertion sites, because the cannulas go outside of the body and back into it. So, and just to be really careful of all those external tubes and wires and such. So patients with lvads can also experience hypotension due to dehydration, infection, GI bleeding. They can also deal with GI bleeding, which I just mentioned. Patients on LVADs all need to be anticoagulated, which puts them at a higher risk. GI bleeding occurs in about 24% of patients with continuous flow LVADs, which is kind of a lot. Dysrhythmias are also, a big risk factor. Ventricular dysrhythmias among patients with an LVAD range from 22 to 52% of patients, and most patients with LVAD have a defibrillator placed. So I will also be talking in my paper about nursing care and education related to the LVAD. I definitely don't feel comfortable caring for a patient with a ventricular assist device. I'm sure most of you don't unless you're specially trained to. So that's kind of a big thing as patients become, as we see more patients with LVADs and other mechanical circulation devices, we will be asked to care for them probably as the population ages and more are implanted. So we need to make sure that there is education done and the nurses feel comfortable. So that's what my paper's on. I hope that, you maybe learned a little something about LVADs and might be able to talk about it in the future. So have a great day. Thanks.